Generally, I like to talk about the longevity of facial fillers and FDA approvals because the way we standardize the discussions around longevity of facial fillers. The shorter lasting fillers are FDA approved for roughly 6 to 9 months. The longer HA fillers are roughly approved for 12 to 18 months. The clinical effect that they carry is dependent on the area of the face that you're injecting. So for instance, in the lips, because there's a lot of motion in that area, they don't last quite as long. In the nose, where there's very little motion, they can last longer. There's lots of areas that facial fillers can treat. It's generally to augment structures or fill in folds or depressions. So for instance, we'll often do cheekbone highlights, we'll change the shape of the nose by injecting the nose. You can make the lips look more voluptuous or full by injecting the lips. We often do chin augmentation with it. You can do angle of jaw augmentation with it, or fill in basic nasolabial folds or marionette lines. Toxins, Botox, Dysport, Jeuveau are all used to relax the facial muscles. So you soften facial expressions, keeping a more youthful, vibrant effect for a longer period of time. Fillers are used to volumize the face to add to areas where you might be deficient in your volume. Liquid rhinoplasty is done to change the shape of the nose. We can't subtract with liquid rhinoplasty, all we can do is add, but by adding, sometimes it's subtraction by addition. We can lift the tip of the nose, we can make the tip look more refined, we can straighten the bridge, hide humps, make the nose look more narrow, are all things that you can accomplish with liquid rhinoplasty. In general, fillers are not painful. We numb you first topically, and then the injections take all of about 1 to 2 minutes, and it's a very relatively pain-free procedure.